Hello everyone, I am Dr. Srinivas Chilukuri, Senior Consultant Radiation Oncologist at Apollo Proton Cancer Center. I am also the Clinical Lead for Pediatric Radiation Oncology Services at our center. Today I am here to tell you some details if a child or a young adult has had a diagnosis of cancer or suspected to have a diagnosis of cancer or has already received treatment for cancer and is worried about COVID-19 infection. Children and young people undergoing treatment and their families will already be familiar with most of the precautions, which are by and large followed by everybody in the public. That is, wash your hands often with soap and water. If the soap and water is not available everywhere, you can use an alcohol-based disinfectant. Try to help your child avoid touching their eyes, nose and face as frequently as much as possible. Avoid contact with people who are known to be unwell, and try and cover your child's cough or sneeze with a tissue and then throw or discard the tissue properly wherever it is recommended, and clean and disinfected surfaces which are likely to be touched more frequently. These are general precautions which everyone should be taking during this COVID-19 pandemic. Face masks play an important role, and now it is being recommended by the government authorities for everyone to wear a mask irrespective of where they are, especially in public places such as hospitals. The most important thing when using face mask, it needs to be worn properly. It needs to be removed correctly, discarded appropriately, also changed frequently, and these are very, very important aspects when one wears a face mask. Yes, all the international professional societies in pediatric oncology recommend usual testing of children when they are suspected to have cancer. There might be certain challenges in getting these tests done in different locations, but having said that, there is an ample evidence that the diagnosis of these cancers must not be delayed. The answer to this question is emphatic yes, because most of the children who have cancer, who are undergoing treatment, we have no better option than to continue the treatment. There may be certain modifications to treatment based on the clinical team, whether with respect to chemotherapy or radiotherapy or surgery is concerned, but most children who are currently on treatment, best approach is to continue their treatment. As I mentioned, there could be certain modifications which need to be discussed with your clinical team. No. Preferably when the child has already been diagnosed with a cancer, has been planned for treatment, it is advisable not to delay radiation therapy or chemotherapy as far as possible. There is no evidence as of now to suggest that by delaying treatment, we are anyway helping the child. It's always better to go ahead with the treatment as planned by the clinical team during this COVID-19 pandemic. The exception to the above being certain treatments such as stem cell transplantation, those are some exceptional situations where the clinical team may defer or postpone certain treatments, especially for those where the procedure is being done electively, not done as a part of the immediate treatment. Only in those situations the treatment can be delayed or deferred. Except for these situations, all children must receive planned treatment even during the pandemic. All the international guidelines now classify children into extremely vulnerable and vulnerable categories. Children who are undergoing active chemotherapy currently, or who have receiving treatment, especially those who are receiving treatment for leukemias and lymphomas, those who have received a donor stem cell transplant or an auto transplant in the last 2 years, or receiving immunotherapy or targeted therapy, are the children who are in the extremely vulnerable category. And the other category of children who could be vulnerable are the ones who have received chemotherapy in the past within the last 6 months, those who have received transplant beyond 2 years, those who have received are receiving radiation therapy to the whole abdomen or to the spleen, which is an immunomodulatory organ, who are on long-term maintenance steroids, or who have completed treatment for cancer but have undergoing chronic lung or liver or kidney or a neurological disorder. These are the children who come into the category of vulnerable. So these are the children who could have moderate to severe signs and symptoms of COVID-19 infection. Shielding is a practice to protect extremely vulnerable children or people from coming in contact with coronavirus. So shielding means strictly avoiding contact with someone who is displaying symptoms of coronavirus. Do not leave your house apart from essential medical visits to the hospital. As far as possible, avoid coming out of the house on most occasions. In fact, the professional societies now recommend a home visit by nurses if possible, if there are children who are extremely vulnerable. Of course, having said that, there are certain challenges in terms of logistics in how to organize extreme shielding in these extremely vulnerable children. That has to be taken on a case-to-case basis in discussion with your clinical team. The answer is yes, it does. There is always a risk that the immunity is low in children who are receiving radiation therapy or chemotherapy or both, and that is why these children are being classified under extremely vulnerable. And as I already mentioned, for these extremely vulnerable children who may have moderate to severe COVID-19 infection or its complications, shielding, extreme shielding is recommended. Well, the parents or the children or young adults who have these symptoms, who have flu-like symptoms or just fever, should follow the normal guidance for attending the hospital. They should immediately reach out if they have symptoms of flu to the clinical team who is treating the cancer currently. They should reach out to them. They should take their guidance on whether they need admission, they need self-isolation at home itself, they need any symptomatic treatment for the same. They should follow the same guidelines which they were doing in the past before the pandemic.